picking up the words of connectedness from Anne and that Karen highlighted about Rocco working with his father and things like that. In mainstream, a lot of my heterosexual friends are busy popping out kids at the moment. Obviously, that doesn't happen as commonly in the gay community. I was just wondering whether there's any data that was picked up through SWASH, a study or anything else, on the impact of biological versus chosen family, or lack of having kids, or choosing not to have kids, or difficulty having kids, or any other sort of biological issues on mental health, and therefore drug and alcohol issues in the gay and lesbian community.
Sort of.
You get the big questions, don't you, Julie? You're like, oh, Jesus. Yeah.
I'll just do some quick analysis in my head of that data. So one of the things that we do know is that, and I think that Karen touched on this in terms of that SWASH really captures a very community-involved group, and the community connection is one of the things that we do ask about. And nearly all of the women in the SWASH sample talk about feeling very emotionally connected to the community in their everyday lives, and I think that's a really positive thing that we should be celebrating. They all talk about having that they all have more than a few lesbian and gay friends. They all do attend gay and lesbian events. One of the things that is changing, and I think that I don't know why this is that we're going to less gay and lesbian events and less gay and lesbian venues than we used to, and we're reading less gay papers than we used to. I think people are going online, and that's something that SWASH hasn't been very good at picking up, but we're looking at it. But I think the questions that you're asking about looking at the relationships between issues like mental health, community, family, are bigger issues than can be dealt with in a survey like SWASH, which is 2 A4 pages that people fill out at Fair Day. But maybe we'll get the money to do that kind of research on the basis of this kind of evidence base.
On the fertility issue, I'll just be quick. I mean, I work in general practice, and I have to tell you, the lesbian baby boom out there really is quite a factor. And when I was young, if somebody came out as lesbian, the first thing their parents would say is, "Oh my God, I won't have grandchildren."
Not anymore. Huh?
That just doesn't happen anymore. Now it's just an assumption of, well, how are you going to pick a donor? So the whole mentality around fertility's changed. There's an assumption that that there's really very little distinction now. Young women who are now partnering up in heterosexual relationships, people are saying to them, are you going to have children, not how many children you're going to have. And on the other side of things, women who are, perhaps coming out as lesbian at whatever age, provided they're under about 43, people are saying to them, well, are you going to have babies? So that whole cultural shift has happened in the last decade.